So much, Mr. Chairman.
We'll now yield 5 minutes to Representative Lieu.
Thank you, Mr. Chairman. I want to commend all the witnesses for coming today and offering your expertise. I want to note that a little over a year ago, Secretary of State Mike Pompeo sat before the Foreign Affairs Committee and in response to my questions, 6 times he refused to say the coronavirus was not a hoax. And now I'm hearing from the Republican ranking member that somehow the World Health Organization is complicit in some sort of fraud. Well, let's look at the facts. In April, Politico published an article talking about our former president. The title of this article was 15 times Trump praised China as coronavirus was spreading across the globe. So if you're going to criticize the World Health Organization, you got to criticize Donald Trump, who went even further than the World Health Organization in simply parroting what China said at the beginning of this pandemic. So instead of rewriting history, we should look at what would help U.S. national security. And my view is being a part of the World Health Organization helps U.S. national security. So I'd like to ask Dr. Jha, is it your view that the United States being a part of the World Health Organization is good for America?
Representative, to me, this is a no-brainer. The answer is absolutely it is good for America for several reasons. First of all, as we've discussed, it's really important that this pandemic be brought to an end. And many, many countries around the world depend on WHO's expertise and guidance on all sorts of issues. Second, there are a set of essential services only WHO can do, the way that they can bring people together, set rules about clinical trials, et cetera. And the question that has been in front of us is, do we want to be part of the global effort to stop this pandemic, or do we want to try to go it alone? And this is not a question in theory, because when we step away, we see others step into that void and take on a role. So I think it's very, very clear to me that WHO needs reform. It needs changes. We are far more likely to influence WHO in a constructive way if we're part. If we walk away, we will have no voice in that reform. And while WHO is only one part of a global health architecture, it is essential. It's the one place where every country comes together. And therefore, us not being part of it really leaves America much worse off.
Great. Thank you. I want to commend UPS for what you've done in distributing vaccines across America as well as around the world. Really appreciate your efforts. And I had a question for you, Ms. Napoli-Nas, which is, what is your mask policy at UPS?
Sorry, sir, our mask policy. So are you asking about specifically in our facilities in the United States as well as for our drivers, or globally?
Yes, for your facilities and for your drivers.
Yeah, so our mask policy is that, like with many employers, we encourage mask use. And I believe that I don't have responsibility for the United States, so I need to come back to you specifically on it. But I know in my own office, it's a requirement that you wear a mask. So
great. Thank you. I appreciate that. Now, Dr. Jha, I'm going to ask you a series of questions that may seem basic, but they just need to be asked. The 3 vaccines in the United States, Pfizer, Moderna, and Johnson & Johnson, they work, right?
They do, sir.
And everyone should get these vaccines when they're allowed to do so, correct?
Absolutely.
Yeah. I note that the former president of the United States hid the fact that he got the vaccine, but he still got it because he clearly believed it worked. Now, when someone is coming in the United States from, let's say, South Africa, Brazil, or the United Kingdom, we don't actually know if they're carrying a virus, right?
Not unless we have tested them thoroughly, Congressman, we would not know, right?
And that's why we want everyone around the world to be vaccinated, not just those in America, correct?
Yes, one of the many reasons we want everybody in the world vaccinated, absolutely.
Okay. Also, masks work, don't they?
Masks are very effective at preventing transmission, and good quality masks prevent you from also getting infected.
And that's because this virus is spread through respiratory droplets. And when you talk or cough or sneeze, you can spread it on doorknobs, at businesses, anywhere you go, correct?
That's correct. And through aerosols, which also people can breathe in. So masks are also helpful there.
Thank you. I'm sorry I had to ask all these basic questions because they're just some of my colleagues across the aisle who continue to reject science. I yield back.